Yeah, and that's a good explanation. That's what people get wrong most often is, they go to the doctor and they believe that when they go there, if they're going there for a surgery or if they're going there for medication, they always believe that they're going to end up coming out better and that their problems are going to be fixed. And sometimes it just goes the other way. You go into a
Hmm.
surgery and
Yeah.
the surgery ends up bad, but just because it was bad doesn't mean that it was malpractice. It's a tough
Correct. Yeah,
concept.
it is. And that's why I'm here. I'm here to help people understand the difference between just the natural failures of our medical system that are, inevitable, and stuff that we can actually pursue a claim against someone for because it was actually, below the standard of care that we define legally.
Yeah, and I want to talk about that for 1 second because the word standard of care you hear so often, especially as lawyers, but if you believe you have a medical malpractice claim, you will start to hear that term more often, standard of care. Help people understand what that actually means.
So the standard of care is basically the threshold, um, standard level of care that doctors are legally, required to provide to their patients. So it doesn't mean the gold standard, right? It's not like best practices. It's basically, the minimum, standard
The
of how people
floor.
should be treated, not the
That's a good
ceiling.
way to
Yeah.
explain it because the gold standard is like the top of the profession. We don't hold all doctors to the top of the profession. We're holding doctors to the minimum standards in the profession.
Yeah.
And so it doesn't mean perfect and it doesn't even mean great. It just means good enough. And if a doctor falls below that standard, then we consider that their actions were negligent.
Yeah, so really we're talking about the worst of the worst, bad actors or really just like negligent actors here. And I think that's why it's important to consult with an attorney when you think something bad might have happened and that your doctor might have done something negligent, because it's really hard for people who aren't in this area of law day in and day out to understand the difference between, something that we might not be happy with, but is legally acceptable, even if we don't think of it as morally or, otherwise acceptable, in terms of what we want to see from our doctors.